All right, good afternoon, everyone, and welcome to today's webinar, What You Need to Know to Protect You and Your Family This Season. I'm Courtney Elliott, the Clinical Director of the Emergency Department at Inova Mount Vernon Hospital, and I'll be your host today. I'm an emergency room nurse with more than 18 years in healthcare experience. I wanted to take an opportunity to thank you very much for your ongoing support and community involvement during this difficult time. Before we get started, I wanted to go over a few housekeeping items so you will know how to participate in today's event. Everyone is muted by default. You will have the opportunity to submit text questions to today's presenter by typing your questions into the Q&A box. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. Additionally, if you would like to ask your question directly, you may raise your hand and we can unmute your mic. Just a reminder, this is an informative talk only and not intended to replace your own physician's advice. Many of the pictures you will see in the slideshow were taken pre-COVID, and I want to ensure you that we're socially distancing and masking at all times. I'm in my office now by myself. I would now like to introduce Dr. Everett Embrey, the chairman of our emergency department here at Inova Mount Vernon Hospital and Inova Healthplex Alerton. Dr. Embrey is a board-certified emergency medicine physician with more than 27 years of experience. In addition to his current role as chairman, he is an attending physician in the Mount Vernon Emergency Department emergency room. As a partner at the Commonwealth Emergency Physicians Mount Vernon and president of Commonwealth Critical Care. All right. Go ahead and let Dr. Embrey take over.
All right, everyone, can you hear me? Great. Well, thank you for allowing me the opportunity to speak to the Mount Vernon community today about such an important topic. This winter will present some unprecedented challenges, but I feel that we are in a great position to be successful this winter. I really want to thank everyone in the community for their outpouring of support for our healthcare workers in the emergency department and the rest of the hospital. There were numerous gifts of food and letters and all kinds of support from the community, which really was hugely important for the staff to continue to work hard and in good spirits. Before I begin the main part of the presentation, which is geared toward infections in the winter season and making sure that you're safe this winter, I wanted to mention a few things. First, Inova is Northern Virginia's leading nonprofit healthcare provider. And without the support, generous support of those in our community, Inova wouldn't be the world-class organization that it is today. All 5 of Inova hospitals are leaders in quality care, and you can be assured that if you present to any of the hospitals or freestanding care sites in Inova, you will get world-class treatment. If there is a condition that we cannot treat at one facility, we have a seamless process in place to be able to transfer you to another facility. This screen shows all the different sites and the number of patients that we treat each year. This slide just illustrates some pictures from the Veach Family Emergency Department. The Veach Family Emergency Department was due to the generous support of the community members in our area, particularly the Veach family, but many others as well. The emergency department was built in November of 2016 and is really a shining star for both our hospital and the Inova organization. The hospital in Mount Vernon has now 35 all private treatment rooms, pediatric treatment rooms with child-friendly amenities, 2 dedicated resuscitation emergency rooms. We have virtual reality for relaxation and distraction, which we found to be very helpful for kids. We use nitrous oxide, which is laughing gas that allows also for relaxation and pain control without having to use an IV. Mount Vernon Hospital is among the top in the state for sepsis management. We've had 4 months in a row now of perfect sepsis care where we met all the needed treatment for the sepsis care for 4 months straight. We're also a primary stroke center, and we're among the leaders in patient satisfaction in our emergency department as well. Just a reminder, our sister facility, Lorton Healthplex, is just down the road off 95. Lorton Healthplex shares a lot of the staff that we have in our emergency department. Sorry. And offers outpatient testing such as mammography, CT, MRI, and also has primary care office on the 2nd floor as well. Most patients that are transferred from Inova Lorton Healthplex come to Mount Vernon Hospital. I wanted to talk next kind of about the main part of our presentation. I wanted to emphasize that if you're having serious symptoms, you shouldn't hesitate to go to the emergency department because it is a safe place to go. And some of the reasons why it's safe to go is that all healthcare workers in Inova are required to get flu shot to protect you for your safety. All healthcare providers use the proper PPE when treating patients. We wash our hands between seeing patients, before and after every patient. We use masks, gowns, full PPE to make sure that you're safe. Patients and visitors who come in are screened for signs of infection, and everyone is required to wear a face mask. This picture just illustrates some of the things that we use for PPE. You can see the N95 mask, a surgical mask, gloves. Not in the picture are gowns and some of the other protective wear that is used in certain cases. There are serious symptoms which, if you experience, you definitely should go to the emergency department. Some of the symptoms include high fever, shortness of breath, chest pain, abdominal pain, numbness, weakness, headache, or dizziness, which can be signs of strokes. There are many other conditions like traumatic injuries where you will want to go to the emergency department as well. Some of the respiratory infections that we see commonly in the winter, and it's really the main part of this topic, of course, COVID-19, which is all in the news and everybody is very familiar with. Influenza A and B are the common strains of influenza that goes around in the winter months. And bacterial pneumonia is another respiratory infection that we see very frequently. And if you have significant respiratory symptoms, you definitely should not hesitate to go to the emergency department. If you're experiencing heart attack symptoms, again, you definitely need to go in right away. Symptoms include chest pain. Pain may be either right or left side of the chest. Different types of symptoms or descriptions of the pain, tightness, pressure, dulls, aching, stabbing. There's no one characteristic type of pain that means you're having a heart attack. Other symptoms that we frequently see with heart attacks are shortness of breath. You can, particularly in the elderly, have just weakness and dizziness as a symptom of a heart attack, and that is true for diabetics as well. Often we see upper abdominal pain as one of the symptoms for a heart attack, which a lot of people don't recognize. And so When individuals come in with these sort of symptoms, our goal is to get an EKG as quickly as possible, whether they come in by private vehicle or ambulance. The chest pain may radiate to your neck, back, jaw, or arms. Abdominal pain can be a sign of something that's a serious condition. Some of the more common things that cause abdominal pain are appendicitis, abdominal aortic aneurysm, which is an expansion of the large blood vessel in the abdomen, gallbladder problem, diverticulitis, which is an infection of the colon, and ectopic pregnancy is another serious abdominal condition that we see. And there are a whole lot of other conditions that can cause abdominal pain. And so if you're having serious pain, fever with abdominal pain, vomiting, or the symptoms aren't going away quickly, you'll want to come to the emergency department. It's really important to know the signs of stroke because time matters for brain. Be fast is something that we're using in Inova to alert the community when they might consider coming in for care. B is for balance. If you have a loss of balance, particularly sudden loss of balance, your eyes aren't working appropriately. They aren't moving the way they should, or you lose vision in your eyes. Facial droop is something that we often see with a stroke. The arms not being able to move properly, either hanging down or just weakness in the arm or hand. Speech can be impaired. That can be just not being able to talk at all or not being able to get the words out properly, even though the speech is clear. Time is brain, so you would want to call ambulance right away if you experience any of these symptoms. Focusing more on the respiratory conditions, which is the main focus of the talk. Bacterial pneumonia is very common in adults and children. Symptoms are fever, cough, shortness of breath, and sputum or mucus. Testing generally is done by, diagnosis is made by chest x-ray. And you can do blood work or nasal swabs, but testing for microbiology testing is generally reserved for those who are being admitted to the hospital, not so much for outpatient testing. The treatment for pneumonia is antibiotics because it is a bacterial infection. And in addition to antibiotics, the usual things like rest, fluids, and acetaminophen or Tylenol for fever reduction is important as well. Prevention of pneumonia is done by a vaccine called the Pneumovax. It's indicated for anybody over the age of 65 and those with other significant medical conditions where their immunity may be depressed. And you'd want to talk to your primary care provider about the pneumonia vaccine and whether it would be indicated for you. But people who have asthma, diabetes, other conditions, cancer where their they may be immune suppressed would be candidates to get the vaccine. The next infection that we see frequently during this time of year is influenza. There is an overlap with all these conditions, and so it can be hard to know just based on the symptoms. But again, fever, cough, shortness of breath, you can have wheezing for any of these conditions, sputum as well. Testing for influenza is done by a nasal swab. The nasal swab we can do in the emergency department. The downside is that it's only about 50 to 60% sensitive. It's very specific. So if the test is positive, you definitely have influenza. But if it's negative, it doesn't rule out influenza, but it definitely can be helpful to know whether you have it or not when you come to the emergency department. Treatment for influenza is similar to the other things with supportive treatment like rest and fluids and fever reducers. But there is a medication called Tamiflu, which is the main one that's used in many cases. And it can be used for patients of all ages, although it's particularly most helpful for those over the age of 65 or who have other underlying medical problems. Prevention of influenza, kind of what we mentioned earlier, is with the flu vaccine. And so the more people that can get vaccinated in the hospital and the community, less spread there is during the year. And so if you must go out, if you have respiratory infections, like we do with concern for COVID, it's important to wear masks to prevent spread and wash your hands frequently. COVID-19, the symptoms are very similar, although there are other symptoms that we don't see with the other respiratory infections very often. One of the common things is loss of the sense of smell or taste. Abdominal pain is very frequently seen with COVID-19, associated with vomiting, diarrhea, lack of appetite, loss of weight. The respiratory symptoms are very common, particularly fever, but the abdominal symptoms are very frequently present as well. Testing for COVID-19, many have seen on the news, primarily the viral test, which is with the nasal swab, but blood testing for antibodies is also now more prevalent, and that shows whether you've contracted COVID-19 and whether you have some protection or immunity against COVID-19. The prevention for COVID-19 will be a vaccine, which is not widely available yet, but as we know is being worked on diligently. The treatment generally is supportive unless you're admitted to the hospital and very ill, kind of like our president, as we know. The two common treatments in hospital for COVID-19 are remdesivir, which is an IV antiviral medication, as well as a steroid, Decadron or dexamethasone. Before we go into the next session of question and answer, I did want to give a few remarks. There is a pretty significant blood shortage due to the fact that people aren't going in to give blood as well. And so I'd want to encourage anyone who's able to donate blood to do so during this winter season. There is quite a bit of a shortage. I want to remind everybody that the emergency department is a safety net for the community. We treat everyone regardless of their condition, race, or ability to pay. It's important during this, particularly during this time of year, to call your primary care provider. If you have any symptoms, they can guide you as to whether they think that you should seek medical treatment. If you have questions, particularly regarding COVID-19, I would suggest that you go directly to the source, the CDC guidelines or the health department, where there's a wealth of information. Much of what you hear on the news is not necessarily accurate, and you want to make sure that you have an accurate picture of what's going on for your health. And again, if you have serious symptoms, we encourage you to go to the emergency department or call 911. The ER at Mount Vernon is here, and Lorton is here to serve you if needed. Now I want to open up the session to questions.
Yeah, thank you so much for that, Dr. Embrey. We definitely want to begin answering questions. We had some questions submitted prior, but just wanted to open it up, and you definitely have the ability to raise your hand and we can give you control to speak. We are taking questions in the chat, and we had a few questions prior. I'm just reviewing the Q&A right now. I don't see any open questions. We had several questions submitted prior, Dr. Embrey, that I would like to go over with. One of our advanced questions from our online form is in regards to, I had COVID about a month ago. Any increase in risk from getting a flu shot?
There is no increased risk in getting a flu shot if you've had COVID. It will be important to get the flu shot because you may actually be more susceptible even to other conditions if your immune system is lowered. So certainly there's no reason to be afraid to get the flu shot. And in regard to vaccines in general, I would look to again, the CDC if you have questions about vaccines. They are safe. I know there are questions about potentially causing symptoms or potentially leading to autism. And again, I would go to those sources to read more about it, but definitely I would not hesitate getting the flu vaccine.
Great, thank you for that. We will answer the next question live. And one of the questions is from, how great is age alone as a risk factor for a very fit senior with no life-threatening health issues?
That's a great question. Though I'm not an authority on COVID and happy to answer any questions, I will say that my own experience in talking to friends and family and treating patients is that even if you're older and you have COVID, if you don't have a lot of underlying medical conditions like cancer, diabetes, asthma, congestive heart failure, cardiac conditions, strokes, if you're generally healthy, even if you're an older individual, you're far less likely to have serious symptoms if you do develop COVID.
My apologies. One of our other questions was in regard is how soon should we get the flu shot?
Well, we as an Inova organization are currently in a campaign to get flu shots, and our goal is for everybody to have flu shots if at all possible by the end of October. We started the program in September, and so there's no time like the present to go ahead and get the flu shot. We are not seeing, fortunately, many cases of influenza yet. It's kind of sporadic around the year, through the year, and it really hasn't started yet, but it's typically will start any time. So the sooner that you get the flu shot, the better, and to protect yourself and your family members.
Great, thank you for that. Next question, what constitutes a high fever as a measure to indicate the need to go to the emergency department?
That's a very good question. So generally I would consider a high fever over 101 degrees. But the presence of fever alone does not mean that you might not be sick. We sometimes see people who come in with very low temperatures, and they can be just as sick as people with high temperatures. So, one thing that I would say is if fever alone is the only symptom, even if it's high, but if you can take acetaminophen and the temperature goes down and you're generally feeling well, I wouldn't say necessarily that you have to rush into the emergency department just for a high fever. But certainly if you have a high fever, and even if it's not super high, but you have other symptoms that are concerning, like chest pain, shortness of breath, you feel really weak or dizzy, or other symptoms that are concerning, or you aren't able to keep fluids down, then that would be a sign that you should definitely go to the emergency department.
Great. I have a transplanted kidney, thus a suppressed immune system. I've had a flu shot last month. I live with a roommate who I learned has not been social distancing nor masking with his family. Should I get tested for COVID-19, although I don't currently have COVID symptoms?
Wow, that's a really great one, and a challenging one. So generally speaking, I wouldn't recommend testing if you don't have symptoms, unless there's certain particular instances, particularly like this one that you bring up. Even if you have mild symptoms where you're concerned you may have COVID, if testing really doesn't change anything, it's not something that necessarily you need to get. Instead, you can quarantine at home for 10 days or resolution of symptoms, and then you would be okay to go into the public. In your situation where you have a transplant, your immune system is compromised, I think it probably would be helpful to have your roommate tested if they're willing, to see if indeed that they have been exposed to COVID, or certainly you being tested as well. But if there is any way to, at least social distance yourself from your roommate, given that scenario, I think that would be a good idea if possible.
Great, thank you. Next question. Which strains of flu will the flu shot cover?
Good question as well. So the flu shot is designed to cover both influenza A and influenza B. The problem is that the flu shot doesn't cover every strain of influenza, and so there's research that's done early in the year looking at other parts of the world where influenza is starting to develop and coming up with an idea of what strains may be the most common in a given flu season. And then the influenza vaccine manufacturers are able to come up with a vaccine which covers the most likely to cause the flu. But unfortunately, there are times when the vaccine is not as effective as it might be to cover a particular type of flu, but just getting the flu shot ramps up your immune system and offers you some degree of protection that you wouldn't have if you didn't get the flu shot.
Great. Another question submitted prior. I think I have the flu. Should I quarantine?
Yes. Much like COVID or other respiratory infections, you don't want to expose yourself to other individuals. And so it's best to stay in your house until you have resolution of the symptoms for 24 hours. And taking the usual precautions that we discussed before: rest, hydration, fever reducers. But if you develop serious symptoms, you want to call your primary care provider to ask questions or go to the emergency department.
Great, thank you. Just making sure I haven't missed any other questions in the Q&A. We do have some prior submitted questions. We've all gone through a lot these last 6 to 7 months. What have hospitals learned about managing a pandemic, and how will you use that knowledge going into flu season?
That's a great question. We at Inova have developed, as the pandemic has come on, a wealth of knowledge about how to treat COVID-19. And so at the very beginning, much of what was known about COVID-19 we heard from Asia, China, where it first started. But the information wasn't necessarily that reliable, and there weren't really known effective treatments when COVID first started. There was also questions or confusion about the spread of COVID-19 because it's a novel coronavirus. It hadn't been seen before. There are a bunch of other coronaviruses out there that have been with us for a while, but this was all new. So it wasn't clear, the right form of PPE, personal protective equipment, to use. And so as more time passed, each and every day, we got smarter and smarter about the care. Inova was on the forefront in our country with COVID care. They developed a COVID response center where staff members could submit questions either online or by calling to get the latest information. And the information about COVID care was shared by daily emails. That is still, all of this is still in place today. And there are updates from Dr. Motu, called the Motu message, which shares best practices for COVID care. There's treatment algorithms so that everybody knows how best to treat with the new antiviral agents that can be used, like remdesivir, Decadron. And so I think that the most important thing has been a widespread collaboration and sharing of information within Inova. And that included meetings and discussions with the Health Department of Virginia, CDC looking for all possible answers on how best to treat patients. And so one of the things that we've done in response is all of the Inova facilities have far more negative pressure rooms. Those are rooms that prevent the spread of COVID from leaving the rooms by exhausting the air out to the environment. And so we are so much better prepared right now than we were very early in the process when COVID first started.
Thank you. We're running short on time, so this would be our last question for today. Is it true that people that suffer from one or more autoimmune conditions should not get a flu and/or a pneumonia shot?
People who are immune suppressed, like with other question, transplant patient, people who have cancer on chemotherapy or other medical conditions, I would definitely recommend that they reach out to their oncologist or their primary care provider or other physicians who are treating them, because I'm not sure that you can make a blanket statement 100% across the spectrum, for both little kids and adults. But generally speaking, the influenza vaccine is safe, even if you have a lot of underlying medical conditions or immune suppressed. And I think that the pneumonia vaccine also is safe if you're immunosuppressed. It's one of the indications why you would want to get the vaccine. And obviously it's a little premature to discuss the COVID vaccine, but the hope is that it will be, safe for all of the community to get as well.
Thank you, Dr. Embrey, and thank you everyone for attending today's webinar. If you have additional questions, feel free to email Champa, our communications and marketing executive. She's put her email in the chat box. Once you leave today's webinar, you'll receive a survey on the presentation, and we would appreciate it if you'd complete that and provide your feedback. You will also receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. On behalf of Inova Mount Vernon Hospital, thank you for joining us today and have a great rest of your day. Thank you.
Thank you so much. It's been an honor to talk to you today. Hopefully soon we'll be able to do this sort of event in person.